Hey, for those of y'all that don't know me, my name is Justin Hudman. I'm the Division Director of Public Affairs for the Texas Pharmacy Association, and the joke I always love to make is just a very polite way of calling me a lobbyist. So my job is to go to the Capitol and to lobby on behalf of you. What I've been asked today is to talk about how to educate you as students on best ways to go and communicate with your legislators, with your elected officials and their staff. So, the first thing I always make sure that I tell everyone, when you think first about communicating, I ask everyone to raise their hands of who is nervous and who is afraid to go and talk to an elected official or their staff. And almost inherently, the vast majority of people will admit that they are nervous or scared. Don't be. The elected officials are people. They live in your districts, they go home, they're normal men and women who have chosen to run for political office and to serve in the Texas legislature. So don't be afraid of them and their staff. I tell everyone, coming as a staffer, my job was to make the people that visited our office happy. I wanted them to leave thinking about how nice we were, because I wanted you to have a positive experience when I was a staffer. So be less worried about what they're thinking of you, because more than not, they're trying to think about what you're thinking of them. So as we go into today about how to best communicate with your elected officials, always keep that in the back of your mind. There's no reason to be afraid. There's no reason to be nervous when you're talking to them. So before we start, I think it's important to have a little bit of a 101 about the Texas legislature, because there's often a lot of misconceptions and people don't always consider or think about the differences between Washington, D.C. and Austin, Texas. We both have elected officials on the congressional side and on the Texas side. But you need to make sure when you're communicating that you understand that you are communicating with your Texas rep, whether it be via email, phone call. Make sure you're talking to the right person about the right issue. I saw many times as a staffer where somebody would email and the issue was 100% federal. And my former boss couldn't do anything to address that. As a state elected official in the Austin Capitol, he had no control over federal law. So just make sure you know you're contacting the right person. Texas has two chambers, the Senate and the House. The senators are senators and the House reps are reps. So make sure when you're communicating with them, you are also getting it correct on which chamber that they work in. They're very different. The number of people a senator represents is in the neighborhood of 680,000. Texas senators represent more people than our congressmen do in D.C., and our House members represent about 167,000 people. So there's a lot more of them, and the districts are a lot smaller. Speaking of size, there are 31 senators, 150 House members, totally combined 181 elected officials in your Senate and your House. That's not counting your governor, your lieutenant governor, or any of the other statewide offices. So now that we have a little understanding of the elected officials in the Capitol, and let's get into how you actually walk in. What do you do? That's a question I get all the time. Well, first and foremost, you're talking to people. You do that every day. You communicate all the time. Don't overthink it. When you go in and you talk to them, understand first and foremost, you may not always get the elected official. If you get staff, I loved it. I saw a lot of depressed and sad faces when people realized they were going to be talking with me and not my boss. But understand that staff has a lot of leeway and a lot of authority on what the policies look like. And they really are able to get into the weeds and get in depth into the policy side of an issue, often much more than their boss is. So take advantage of that. Make sure you're really taking that opportunity to educate them on the nuances and the details of the issues that you want to talk about. So point one, introduce yourself. Hi, my name is Justin Hutman. I go to the College of X. So introduce yourself, let them know that you are a pharmacy student. Let them know that you live in their district. For those of you that are going to see your elected officials where your school's located, let them know that you attend the school in their district. If you're going to where you live, again, make sure you let them know, I live in your district. I am a constituent. So when you go in, let them know what year you are. A lot of times students, y'all all talk, it's P1, P2, P3. Well, understand that that may not be a phrase that the elected official understands. So just say I'm in my second year out of 4 of my pharmacy education. It's a little easier to understand. Understand when you're talking to them, they're going to know very little about pharmacy. Unfortunately for us in pharmacy, there is only one elected official that was ever a pharmacist now in the Senate. We used to have Senator Vanderpute in the Senate, and we used to have Representative Hobson in the House. We don't have either of them in the offices anymore. So Senator Schwartner is our only pharmacist. So he understands the jargon a lot better, but understand the vast majority of the rest of the members have very little interaction when it comes to dealing with pharmacy. So before I go too much further, I do want to let you all know, make sure you're going to TPA's website under the Advocacy tab. We've got a lot of materials that we have available to you to look through that help teach you on what to say, how to schedule an appointment, how to follow up with the elected official. Some of it's pretty general that you should know, but a lot of people may sometimes not even think about or realize that it's important. From be professional. Don't argue with the elected official. You're there to help and educate them. Generally, they don't want to be argumentative, but they may ask some tough questions. Just try to answer that question to the best of your ability, but don't answer something if you don't know the answer. You're always able to say, I don't know. I will get that information for you, and I will follow up with your staff to let them know. In the scenario that you've met with the member, if you're meeting with the staff, just let that staff member know you'll follow up with them with the information that they're looking for. You're there to be a resource for them. That's your goal. You want to be the expert that they turn to, anything relating to pharmacy and medication. I like to make sure when I talk to the elected officials on your behalf, and so I highly recommend you do this as well, is particularly as a student, talk about your education. Talk about what you're going through. Tell them it's 8 to 10 years of education and training. It seems to be the standard nowadays, that very few pharmacy students get into the pharmacy school without first doing 4 years of undergrad. That you take a number of years to be educated to be pharmacist. Make sure that you relay that. Talk about the level of knowledge that you're being trained on in pharmacology, how you're learning about how the drug interacts with the human body, how to make sure you're getting the most out of each of the medications that you're taking to get the best efficacy and to get the best results. Make sure you relay that, because that'll help frame any discussions you move on past that point when you're talking about moving into services, or you're talking about being paid for what you do. The more they understand, and you'd be surprised, very few really truly understand that you are getting your doctorate of pharmacy. They know that you count the pills and the medications, but have really no idea about the level of education that you're going through to be able to become licensed pharmacist in the state of Texas today. So make sure you're educating them on that. Make sure that you're talking to them. When you go in and you talk to them about the issues, talk about it from your perspective. I'm a big advocate about making the issues personal to you, and as much as possible personal to the member. So how do you make it personable to the member? Do some research. Once you set your appointment with your elected official or a member that you're trying to go and speak with, take some time, learn about their district, learn about their population, learn about whether they're underserved, whether they have hospitals in their district, whether they're rural, urban. Figure out the challenges that they may have and look at ways to relate the issue you want to talk about so it makes sense for them in their district. But it also needs to come from you and be personal. I always relate a lot of my recommendations to my time as a staffer, as being on the other side, the receiving end. that I heard a lot of people talking. I watched a lot of people walk in with their pieces of paper. They had their talking points and they essentially read verbatim those talking points. They didn't make very big impacts on me because I can read that document myself. I didn't need you to walk me through it or read me through it. The ones that made an impact on me were personal stories. This is how this bill will impact me. It will impact my profession. It'll impact my ability to help my community and my patients. And when you talk about it in that way, it resonates. It strikes a chord with that member to really outline and show this is why I need to be concerned about this bill. If you bring it from a personal perspective also, I find that it's more natural. That when you can connect it and relate it specifically to you, it's much easier for you to relay that message. If you're trying to talk like Justin talks and go in there and speak just like me or just like anyone else, you're generally going to automatically be uncomfortable because you're going to be using verbiage or speaking in a way or trying to articulate a message in a way that may be very different than your normal pattern. So if you connect it to your personal life, to how it impacts you or a personal experience or a great example, and I'll talk more in depth on the bills here in a bit that we're running with this session. But if you take a specific issue and you go, back 10 years ago, I had an issue with this, and it would have been great had I been able to go down to my pharmacist and that they would have been able to help me with that. But now that I'm in pharmacy school and I understand that they're not able to provide those kind of services, whether it be statutory limitations or whether it be lack of reimbursement for the services that they provide. But you start tying it into, this is why it makes sense in reality. Here's the law, here's the statute, here's the policy, here's how it actually makes sense. Here's a great example of that. Charlotte Weller was our president of TPA the last legislative session, and most of you hopefully all know about the epinephrine bill that was passed, which gave you, once you become pharmacists, gave you the authority to administer epinephrine in an emergency situation. It's a very simple concept, very easy to understand, but when Charlotte shared with me her personal story, I knew we had the message for that issue, because what Charlotte was shared with us and ultimately later shared with the elected officials when she testified in the House and when she testified in the Senate, it resonated with those members because she talked about the time her husband was away from their normal community and their son went into anaphylactic shock, and he rushed not knowing where to go, not knowing where the hospital was, not knowing where the help was, but he came across a pharmacy. And that pharmacy at the time arguably violated the law by administering epinephrine to her son. But we all know that pharmacist did the right thing, but the law didn't allow for it. She shared this personal story, and I watched faces. I watched the members in the House and I watched the members in the Senate, and you see all of them take a moment to think about, what would I have wanted that pharmacist to do if it was my child? That personal story, I give tremendous credit for the reason why that bill passed. And it was an easy story for Charlotte to share because it was her story. So I use as an example when talking about how do you make your message personal, because you'll resonate more, you'll be able to talk from the heart and much easier. It's not forced conversation, but it also gives something that only you can give. That's your story, so it's unique. When you walk in and you share that message and that story, when you're advocating on that bill that this is how it would work, this is what it would do, this is how it would make lives better, this is, when you start tying it to a much more personal position, it's unique to you and it goes outside the norm of what staff gets. Staff gets talking points all day long. I had entire mountains on my desk of talking points. And they're important, they're helpful for staff, they're quick resources for staff to go back and look at, but that's a document you can leave behind. The stories are something only you can share. So I always suggest when I'm telling and giving recommendations to make sure that you make your message personal. It'll stand out, it'll have greater impact. Now, what do you do when the meeting's over? Thank the elected official or thank their staff for their time. Let them know you want to be available to them anytime a question relating to pharmacy pops up. You want them to know that you're there, because something that not a lot of people realize is that when you're an elected official, it always makes me laugh that as the electorate, we elected a member of the Texas House or Texas Senate or Congress, or even our city councils, and we expect they immediately know everything about everything, but they don't. They often have very limited knowledge and a wide array of issues that they're going to be asked to make very important, life-impacting decisions on. So they're constantly looking for those resources. So offer yourself as a resource. Let them know you're happy to help them in any way that you can. So leave your information, your contact information. Make sure it's up to date and that they have all the ways that they can access or reach out to you. And we often recommend, about a week later, go back, write a thank you letter thanking that staff member or the elected official for their time. Thank them for their willingness to meet with you to talk about the issue that you spoke with them about that day, and that you were very interested and hope that there's anything that you can do that they will reach out to you. Now, a real quick important side note that I get a lot of times asked about, do I really push them to support my issue? Obviously, you ask and tell them you would love their support on the issue. You're happy to answer any questions or address any concerns that they would have, but don't pressure a position. Good staff will never give you a position of their boss, and most elected officials may not know enough at that time to give you an informed decision. So I often advise against people pushing for, will you support my bill? There are people that do that, and for me and as a staffer, it was never very appropriate in my opinion. So I always just say, offer up the ability to answer any questions or concerns that they may have. But so when you follow up, just say thank you for your time. Again, I'm a resource. So that's what we have today as far as how you communicate with your elected officials. There's a lot more nuances and a lot more that goes on in a communication, but a lot of that, it's not something you can teach, in the sense that the most important thing is for you to be comfortable. It's a conversation. You're talking with another person. Yes, they are somebody that's been elected to office. Yes, they often wield a lot of control and power as far as their ability to make decisions on law. But fundamentally, they are still people, and you talk to people all day long. That's the most important thing I could say, is just be comfortable. There's no reason to not be comfortable in that situation. So what is TPA doing? What are our issues this coming session? We've taken a while to be able to pin those down, but thankfully as of December, our board has finally finalized our legislative agenda, and we've been putting a little bit out there to let everyone know about what's going on. So here are our issues. First and foremost, we will rerun the bill that we filed last session, which seeks to clarify in Texas that pharmacists are healthcare providers. Now, I always make sure that everyone understands that the issue going on in DC with provider status is very different than the issue we have in Texas. Under the federal law within Medicare, pharmacists are excluded from those that may be paid for services. So inclusion as a provider in that code is necessary in order for pharmacists to be paid for Medicare services. In Texas, we cannot find any limitation or prohibition or need for inclusion in a section of statute to give insurance companies the authority to pay you. They have that authority today. They have chosen not to pay pharmacy for services. I can't tell you why. Only they can really explain their reasonings and their thought process not to include pharmacists under their payment structure as a provider. But statutorily, there's not a great need for pharmacists to be recognized the same way that is needed in DC under the provider status bill. With that, TPA's second bill is going to require that health plans and the payors pay pharmacists for the services that you provide. If, as a pharmacist, you are practicing within your existing scope of practice and you're providing a service in which that insurance company is paying another healthcare provider to provide. So a good example of that is always a good segue for me into the third bill. It's the CLIA bill. Well, under current law, you as pharmacists can perform CLIA tests. That's CLIA. These are tests that have been waived by the federal government, authorizing pharmacists to perform, or not necessarily pharmacists, but authorizing individuals to perform tests that, while may be considered a laboratory test, don't require a structured licensed lab. Good example of what qualifies as a CLIA test is a pregnancy test. We all know those are generally taken at home. Everyone who needs one can easily handle it and take care of performing that test on themselves. So the tests in of themselves are generally not complicated. They're very user-friendly, very easy to perform. And you, once you become a pharmacist, and even today, outside of being a pharmacist, you can perform those today, but you don't get paid to perform that service. Most insurance companies do not have a structure by which you can bill them for performing a CLIA test to determine whether or not someone may have high blood pressure or early onset of possible diabetes, or concerns relating to somebody possibly having diabetes or other healthcare issues. So we want to make sure that you can have the ability to get paid for the services that you can provide. We know that as pharmacists, you have an awful lot to offer to the healthcare profession if only you're reimbursed. And you are going to enter the healthcare, and you do a lot of what you do because you care about the patients you serve. But we also have to be able to articulate and get them to understand that in reality, you are also still running a business. And in order to run a business, you must make money. It goes hand in hand. You're not opening up a nonprofit charity. You're a part of a profession which is a business, and you have a right to be paid for the services you provide, just like plumbers expect to be paid when they come in and fix your plumbing, or the mechanic or anyone else that provides a service. They expect to be paid for the services they provide, and it's their right to be paid for the services that they provide. So on this CLIA concept, this is our Enhanced Patient Access to Services bill. This is about giving pharmacists the authority to furnish medications based on CLIA tests and those that are considered non-diagnostic. So right now our bill is really broken up into three categories in which a pharmacist would have the ability to furnish medications. That first category is the acute category. These are health conditions that need a course of medication, and then the health is improved and they move on. No longer a need to be under care for that particular health condition. The two in this category are pretty easy for most people to understand: flu and strep. If any of y'all have recently gone into a physician's office for concerns regarding flu or strep, they don't look in your mouth anymore and say, based on all the hundreds of thousands of cases that I've seen, you have strep or you have flu. No, they end up taking a swab of your mouth, putting it in an indicator, and that indicator will tell you, do you have strep or do you not? Do you have flu or do you not? It's pretty black and white, and that is a CLIA test. So we are going to seek the authority for you, pharmacists, to have the ability to furnish a medication based on the results of the CLIA test. So, for example, if I walked into my pharmacist and I said, my throat's really sore, I'm not feeling well, and the pharmacist goes, well, hey, let's perform a strep test real quick, swab my mouth, put in an indicator comes back and says, yep, you've got strep. Well, the pharmacist would then have the authority to furnish you, the patient, with the medication to treat strep. Same thing with flu. These are pretty straightforward. These aren't issues or health issues that anymore require a diagnosis. These are very straightforward and very simple, and I've gotten a lot of great responses from people in the legislature that I've shared this with. A lot of people see the value, from parents just wanting the ability to take their kid down to the pharmacy versus spending 2 hours in a physician's office. Second category, chronic condition. This one's a little more complicated and this one's a little more challenging, but the idea and concept here is for pharmacists to have the authority to provide or furnish a medication based on a test relating to a chronic condition. So these would be for individuals that aren't currently diagnosed with an existing condition. So if I walked in and I wanted to get tested for possibly having diabetes, you could perform a test. Based on that information, you would have the ability to furnish me with a medication, but you would be required to recommend or to refer me to a physician for further treatment. Any medication that would be furnished under that scenario would be a very limited amount, and the patient would have to establish a relationship, if they don't already have one, with a physician who could help establish an actual treatment plan. Now, the hope there is that we help healthcare find the patients out there that aren't currently known, and also hopefully we create avenues for you to work relationships with physicians where then you can come back in under the treatment side and help monitor that patient, help the physician get the results that they're looking for out of the medications that they prescribe for that patient. Third category, non-diagnostics. These are medications that don't require diagnosis at all to obtain. Easy ones to understand on that is travel medications. So these are not medications that are your normal scripts that you need for travel. No, these are medications that you have to have when you travel to a specific locale. So let's just for sake of discussion, say anti-malaria medication. If you're going to the tropics and you're going to a place that has high levels of malaria and you need a script for anti-malaria, well, you would then just go to your pharmacist and your pharmacist would be able to furnish you that medication. You don't need to access that medication based on a diagnosed health condition. This is preventative. This helps keep you from having a problem. Others that fall into this category are prenatal vitamins, smoking cessation, hormonal contraceptives. These are all things that you don't need a diagnosis per se to access. These are things that either you do need or you don't need. So they're pretty straightforward. So that's the three categories that we're looking at. I talked prior to this bill about the reimbursement bill. We also have that bill in this bill as well. We're looking to take two shots at this issue. We're going to try to take two bites at this apple because these are tall orders. All of these bills that we're going to run with this coming session are tall orders. They're going to be challenging to pass, and really some of the biggest challenges is just educating and really trying to get elected officials to understand why these are so important to pharmacy and how they can impact healthcare. The last bill that we have has to do with workplace issues and workplace safety, particularly as that relates to the patient's safety. So we've heard from a lot of pharmacists. TPA ran several studies, went around the state talking with pharmacists across the state, those that were TPA members and those that were not TPA members. And we heard a lot of concerns regarding the number of hours pharmacists were being required to work. We had a lot of pharmacists that said that they were being asked to work often beyond what they felt was safe or that they were comfortable with, and have often shared with me privately, having gone home many times not really even remembering portions of their day. And so there was a great concern about how that was going to impact the safety of their patients. Are they accidentally misfilling a script, or is there errors that are occurring? And unfortunately, as fatigue sets in, the risk to that, it grows. Your job as pharmacist, as you become pharmacist, it's a highly challenging job that requires somebody that is hyper-focused, is using a lot of their cognitive abilities to track the medications, to make sure that it's safe, to make sure that this patient doesn't have a reaction, or to the other medication. You do a lot of mental processing in your job, and as humans, you will fatigue. Just like if you take someone that works outside doing a lot of manual labor, eventually fatigue will set in, physical fatigue, and they will be exhausted. Your brain is the same way. We all have limits in which our brain basically says, you need to let me rest. So this bill will look to have pharmacists not be able to work more than 12 consecutive hours in the practice of pharmacy. The intent there is specifically filling medications. If you're doing paperwork for your pharmacy or other things, that is not the practice of pharmacy. The practice of pharmacy as it exists in law today is the filling of medications. So the goal and intent there is purely under the prescription filling area. In addition to that, you would be required to have 8 hours off prior to your next shift. So that guarantees some time for you to recoup, regenerate, let your brain rest, come in the next day refreshed and able to provide the great services that you so routinely are used to providing your patients. The last part of that would be the ability for you to have 2 15-minute breaks to use during the day how you see fit. Now, a lot of employers out there, they're wonderful. They offer the opportunity for our pharmacists to take these breaks, but this would actually require it in law. This would say you need to take 15-minute breaks. And we see it pretty standard throughout the business world that people, after about a 4-hour shift, will take a 15-minute break to recharge, recoup, take care of whatever they need to take care of, so that then they come back to work, they're better focused, and they're better able to do their job. So that's the idea. This is what we're shooting for. As I said a while ago, these are big bills. These are going to be challenging. I like to always be upfront and honest with everyone that I talk about on bills. These are challenging issues. These are concepts that are going to be unique to some legislators. These are concepts that a lot of legislators aren't going to feel like they're really highly educated on or able to make the decision, but that gives us a great opportunity to educate them, teach them about it, let them know why that this is important, let them know what we can do as the professional side of pharmacy to help them make better decisions, because ultimately it helps them and it helps their patient. I hope to do more stuff like this more often. Keep track of us on Facebook and other mediums that we're going to be doing a lot more videos, trying to talk daily and routinely about what we're doing in the Capitol. If any of you watching this have questions or would like to learn more, I'm looking at trying to do a follow-up video depending on the number of questions that I get, which I will answer each and every one of them that you give me directly on whether it be on our bills, whether it be on how to talk to legislators. I have a very open door policy. I'm always available to all of you anytime. Do not hesitate to reach out to me. Look forward to seeing y'all on Capitol Day, February 28th. Come out, be there for your profession, and be an advocate. Thank you.